Happy Friday, everyone. Welcome to the Saints and Alumni Show. As always, right here on WVCR 88.3 The Saint. I'm your host this week, Joe Formusa from the class of 2012. This week, we're talking with Melissa Darbandi. She's the manager of patient and community outreach at the Leukemia and Lymphoma Society. The Leukemia and Lymphoma Society is doing great things here in the Capital Region and the Mid-Hudson region and even like tri-state area. We're going to talk about an event that happened last night, as well as an initiative that LLC is doing to connect resources to families. A lot of great things to talk about. She is a wealth of information, especially for those who need those resources. That's all coming up next half hour. Stick right here. 88.3 The Saint. We'll be right back. Welcome back to the Saints and Alumni Show here on 88.3 The Saint. I'm your host, Joe Formusa from the class of 2012. Today we have a very special guest, a kind of a different approach today. We're talking with Melissa Darbandi from the Leukemia and Lymphoma Society. She is the manager of patient and community outreach. Melissa, thank you very much for coming on today.
Yeah, thank you so much for having me.
So WVCR is a proud sponsor of Light the Night, which happened last night virtually, and it helps support the Leukemia and Lymphoma Society. For those of us who don't know what it is. I heard it was a great event. I heard you had a lot of sponsors, raised a lot of money. Let's go back to last night a little bit and tell us, what last night entailed and kind of what people experienced.
Right, absolutely. So at Light the Night, it is our aim to bring light to the darkness of cancer through research and cures. Light the Night is a series of fundraising campaigns through LLS to help fund research and find blood cancer cures. And really the idea is we really just want to bring hope instead of despair by working to ensure access to treatments for blood cancer patients, as well as bring the community together. So it's a very close-knit community experience where we all come together to light the night, in the world of cancer with illuminated lanterns and kind of support each other with a night of hope.
Now, obviously, the COVID pandemic has changed the way a lot of us do events. A lot of us, go on with our lives. How has that kind of shifted the focus of how Light the Night is put on? I mean, obviously this year is virtual. Was last year virtual as well?
Yes, last year was virtual, and this year will be virtual, or was virtual again.
So tell me how, just I guess on a broader scope of things, how the COVID-19 pandemic has kind of shifted the way you operate with the Leukemia and Lymphoma Society.
Right. So, we were caught off guard along with the rest of the world with the COVID-19 pandemic last year in March of 2020. We were lucky enough with our IT systems and our great leadership that we were able to transition to a completely virtual organization. It's really important to us as a healthcare organization, that works with the immunocompromised to really not take any chances during this time. So we've been working online, we've been working on Zoom and Teams, and we've really, challenged, the idea of working remotely as not being as impactful. We've actually had a very impactful year. So, we create new virtual platforms. We have meetings with, sponsors and donors, from further away that kind of, gives us the opportunity to meet with people further away where we don't have to commute that long distance. So in regards to Light the Night, traditionally, of course, it is an in-person event, and we do hope to get back to that someday when we're ready. But LLS's priority is the safety of our volunteers, participants, and patients, of course, that we serve. So when COVID cases started to rise again, LLS had to make the tough decision to go virtual again this year for last night's event.
Now, I'm looking at basically a recap of last night's event. And something that I see here that is pretty unique and pretty cool in a sense is event goers being able to communicate with those survivors and remembering those who family members or friends have lost. I'm seeing here there were like three kind of factors in last night's event: a circle of survivors, a remembrance pavilion, and then a celebration by raising your virtual lantern. Could you walk us through, what those kind of pieces of last night were?
Sure, absolutely. So patients are able to go to the Remembrance Pavilion, which typically is kind of a blown-up dome where patients can go in, and it's a quiet experience and kind of remember those that they have lost. So this year, we're still able to create that experience where through the online platform, you can go into that same tent, and write a little note, just something that you remember about your loved one or, a message of hope or just anything like that, and kind of post it on the virtual wall where others can see or others, don't look at it, kind of depending on what you want. So that's just a really great way to, have a little moment of quiet to remember. And then the other two parts are really kind of honoring survivors, that are still with us, still fighting, or are survivors at this time. So we use, the pavilion and also the lights and the white lanterns to really honor their journey and really just kind of acknowledge what they've been going through and how hard they've been fighting ever since, because that's really what the event is for.
Let's kind of widen the scope here in terms of the broadness of Leukemia and Lymphoma Society. I myself have heard of Light the Night. I've never participated in one. But again, I know it's a big part of this community, and obviously WVCR is a sponsor, so Siena College in a way is also a big part of this as well. Could you kind of give me an idea or kind of discuss if someone is looking to participate, why should they, even if they don't know someone who may be affected by leukemia or lymphoma?
Sure. Yeah. So a lot of people that do participate in Light the Night and fundraise for the Leukemia and Lymphoma Society don't necessarily have that direct connection to a blood cancer patient. It's still an extremely impactful event, still a very impactful organization that does a lot of our research has led to, changing advances in immunotherapies, genomics, and personalized medicine that just, it reaches beyond blood cancer. So the treatments that were pioneered for blood cancer research are now saving the lives of people affected by many different types of cancer. So breast cancer, bone cancer, brain, kidney, liver, lung, just to name a few. So really our mission, is to cure cancer in general. And I think, everyone can get behind a mission like that.
Now I'm seeing, at least at last check for me, last night's event raised close to $300,000. If someone didn't participate last night, how can they get involved? And let's say, can they still donate to or, make a gift towards Light the Night in some way, shape, or form?
Right, absolutely. So, anyone can still go to lightthenight.org, find that, local Albany event, and they can still make donations online. Absolutely. Not too late.
Could you give us that website real quick so that our listeners can jot it down? And obviously, if they're listening to this on our podcast, they can have that as well.
Right. You can go to lightthenight.org. And then once you get on the website, you can search for the local event. So you would put in Albany for our local event here, and they would take you to the event site there where you would be able to make a donation.
Excellent. Yeah, I did this. I did a quick dive into the website before our interview here today, and it's real easy for those listeners out there if you're looking to get involved. It's lightthenight.org. Just search for the Albany event. Let's talk a little bit about what you do, because kind of looking at your title, it seems like something that, and if I understand correctly, you kind of are a big part of reaching out to the Mid-Hudson area as also well as part of Connecticut. Is that correct?
That's correct.
So let's talk about what your day-to-day entails. Like, obviously it doesn't, obviously Light the Night is a major part of, probably your yearly fundraising, but give us a kind of a day in the life of you and how you're reaching out to people to try and get donations and outreaching to them to come support your cause.
Yes, absolutely. So I am the local patient and community outreach manager for the Connecticut Hudson Valley region of the Leukemia and Lymphoma Society. So what that means is that I am constantly connecting with patients, healthcare professionals in order to connect with blood cancer patients as soon after diagnosis as possible so that we can connect them with LLS resources, community events like Light the Night, as well as education resources, really just to support them. Our region is a big one. We cover Connecticut, Westchester, the Upper Hudson Valley, as well as we stretch into Vermont as well. So a lot of my day-to-day really looks like connecting with healthcare professionals to educate them about LLS services so that we can better help blood cancer patients together.
Excellent. And I think that's it's a major undertaking. Because I was sorry, I was just a little thrown away. You mentioned so many places and so many, so much outreach that you have to do.
Right.
I'm kind of let's shift it a little bit back to you a little bit because this is something that, as you've been talking about your work with Leukemia and Lymphoma Society, what drew you to this organization? To what drew you to this job? Let's say.
Yeah, really good question. So like so many other people, my life has been, affected by cancer through my loved ones. I think that it's a very universal mission to want to find, different treatments and cures for cancer. So certainly I wanted to hop on board that mission. LLS has, invested so much into research and so much into supportive services for patients that not only affect blood cancer patients, but also help patients and family members and loved ones, with other types of cancer. I just really wanted to be a part of that. And it also comes from, my love of working with patients and healthcare professionals and really kind of being in that space of helping people get connected with resources that help them through a tough time.
Awesome. I think that's great. And it's always great to speak with people who do rewarding work like that. And it's always an interest to me as to, hence why I asked, what kind of drew you to a position like that? To our listeners, again, we're talking with Melissa Darbandi. She's the manager of patient and community outreach at the Leukemia and Lymphoma Society. Melissa, we have to take a quick break, but when we come back, I want to talk about an initiative that you were a big part of through LLS. Do you have a few minutes? Can you stick around? We'll come back.
Absolutely. Thanks so much,
Excellent.
Joe.
You're listening to the Saints and Alumni Show here on 88.3 The Saint. Don't go anywhere. We will be right back. Welcome back to the Saints and Alumni Show here on 88.3 The Saint. Some shameless self-promotion about our show before we get back to our guests here. The Saints and Alumni Show is also a podcast. So if you have Apple Podcasts, Spotify Podcasts, I think we're also on Google as well. All you have to do is search the Saints and Alumni Show. I think you can also search WVCR. You could also search Siena College DEA, which is the department that I'm a part of. Please subscribe. Every show that we've done going back to probably April is on there. A lot of great guests, a lot of great people, a lot of great stories to tell, and it's all there archived. So if you miss an episode right here on the radio, you can go back to the podcast right after that show airs and subscribe and listen. Again, that's Spotify, Apple Podcasts, I believe Google as well. Just search Saints and Alumni Show. We're also on YouTube. Our alumni office puts this on YouTube every week. Just search Siena Alumni Relations on YouTube as well. We're talking with Melissa Darbandi from the Leukemia and Lymphoma Society. She's the manager of patient and community outreach. Melissa, thank you again for sticking with us here today.
Yeah, thank you, Joe.
So in the last segment, we talked about an event that was last night, which was Light the Night, which once again, WVCR is a big part of. But we want to transition a little bit now into something that I think is really special and rewarding to children, which is the LLS Children's Initiative. Could you kind of walk us through what that is on a broader scale, and then we can dive a little deeper into how you're a part of this?
Right, absolutely. With the LLS Children's Initiative, we're taking a revolutionary new kind of 360-degree approach to next-level blood cancer care. So what that kind of means is that we are on a mission to take care of the next level, to improve the quality of life of children with blood cancers. With the Children's Initiative, we're advancing pediatric research globally bringing together doctors, ARMA, researchers, and scientists to find safe, less toxic, and more effective treatments for our kiddos. We're breaking down barriers to create a new data commons, which is a platform that ensures consistency in data reporting globally. Through that, we are looking to accelerate progress to find less toxic therapies, for our kids. Because, as a lot of healthcare professionals know, while we have taken steps to improve cancer treatment for kids, there's a lot of late effects, that happen that will affect them later on in life. And we just found that unacceptable. So that is kind of what brings us to the Children's Initiative.
How old is this Children's Initiative? I mean, it's something that came across my brain, over the past couple of days. Is this a new initiative? Is this something that kind of evolved from something else?
So this started about 2 years ago. Since through all the data, we have been seeing that, 40% of pediatric cancers are blood cancers, and approximately 80% of childhood cancer survivors, develop one or more chronic health conditions as a result of their treatment. And only 5% of oncology drugs have been approved for first use in children. So that 5% is where LLS said, we need to do something. So about 2 years ago, our leaders created the Children's Initiative, and really it's just kicking off right now, finally. Our chief medical officer has worked tirelessly to work with the FDA, with global partners, and we're looking to enroll children in our first clinical trial, which is called PEDAL. It's a pediatric acute leukemia master clinical trial, and we're hoping to start enrolling kids in that at the end of this year. So we're excited about that.
I'm seeing kind of how, obviously, this is phenomenal that, families and young patients can have this resource to connect them with, like you were saying, treatments, doctors, nurses. How does this all work? So let's say you have a family and they have a young child who needs support, who needs treatment, who needs that help. How would a family go about doing that to take part in this initiative?
Right. So usually how new pediatric families will get connected with LLS is through their healthcare provider. So we work very closely with Albany Medical Center in Albany and the Melodies Center, who do see a lot of hematology oncology patients. And what we do there is we provide resources to that clinic so that they can connect pediatric cancer patients with LLS, and we can connect them with all of our resources. And then if it's appropriate, we will connect them, with clinical trials as well. We have a clinical trial support center that offers, extremely good, stewardship through the clinical trial process, everywhere from, what is a clinical trial all the way up to how to talk to your doctor about clinical trials, and then connecting them with resources to kind of get them to and from those clinical trials and things like that. So generally, our patients will find us through healthcare professionals.
I do see here, at least in some of the information that we have on our end. Could I put out this phone number? It seems like there is a support number that people can call if they have some questions.
Absolutely.
So I'm looking at, I believe it was 1-800-955-4572.
Yes. So that is our information resource center. And through that phone number, which is 1-800-955-4572, you will be connected with one of our information specialists. And I know it's an 800 number and you think you're going to be put on hold forever, but I promise you that there are nurses, social workers, health educators on the other side of that phone that are available to speak one-on-one with you and can assist you through cancer treatment, any questions you have, all of our financial assistance, as well as other financial assistance when LLS does not have that. They can help with social challenges and give up-to-date disease treatment and support information. So really that's our gateway, our front door into the organization. I always say if you remember one thing from what I talk about today, it's to remember the Information Resource Center and that phone number.
Forgive me if we mentioned this already. Is there a website that, let's say, families can go to learn more about the initiative and take part?
Absolutely. So everything that I've talked about today, everything that LLS has to offer is on our website at lls.org. Super easy to remember. And a lot of information about the Children's Initiative as well as our other, community resources are listed there.
One thing that I'm seeing here on this LLS Children's Initiative website is the stories from families, from patients. There's a lot of great stories on there. If anyone has a chance to go to that website, lls.org, learn more about the Children's Initiative, read these stories. We're not going to dive deep into any specific ones, but what are you hearing from families and patients who have taken part in this and gotten the help through LLS? What are the stories that you're hearing overall in terms of the help they've been getting?
Yeah, so we're hearing from our families that we are just, a valuable resource. I hear a lot of patients saying that they, didn't know all of the different resources that we had until they connected with one of our information specialists, until they connected with myself. There's so much to take advantage of within LLS that, it's a gold mine of different resources. We can connect patients with other patients to talk through issues. We can connect them with, resources on financial assistance and advocacy and research. So one of the more unfortunate things that I hear about from patients and caregivers is I wish I knew about you when. So sometimes patients will come to us a little bit later on, when they've sort of slowed down from their cancer treatment, and they'll finally connect with us and they'll say, wow, I really wish I knew about these programs when I was first diagnosed because I could have used those. So that is just an unfortunate thing that I hear sometimes and why I work so hard to spread awareness about LLS to our patients and community that we serve.
And that's why we want to get your message out as well. That website, again, for our listeners, lls.org. If you or someone you know needs that help, needs those resources, the LLS is there to help you through treatment, through resources, through doctors, through nurses. I think it's awesome. It's a great way for families to feel, obviously it's a terrible, undertaking for families and even for young patients, but to know that someone is there to help, I think that's, so rewarding in the end.
Absolutely.
So we have maybe a couple minutes left. We've talked about Light the Night. We've talked about the LLS Children's Initiative. Obviously, we talked about how COVID has kind of changed our operations a little bit. Let's look ahead over the next, let's say year to couple years. What is LLS looking to do to, let's say, expand resources, perhaps put on more events? What are you guys looking to do more of what you're doing, let's say?
Yeah. So really good question. So we are, of course, always looking to expand and improve and be more inclusive, to all of, blood cancer patients because as we know, cancer does not discriminate. So now we are working on being more inclusive and doing more outreach to underserved communities. So that does include, racial and ethnic minorities. We're looking a lot at improving our resources for young adults. As well as rural populations. So, we know that it's hard to get to the doctor's office with travel and all that through rural towns. So I am working on an initiative to do a better, do more outreach to the rural communities of upstate New York and Vermont. So what that looks like for me is doing some education events, partnering with some of the organizations that are already doing that work. And then figuring out how we can work together to just really spread awareness about resources and help patients that, might not even know about us. So those are sort of the things that we're looking at, of course, and our general mission too, which is to, find cures for, leukemia, lymphoma, and myeloma. So continuing on with our great work, and hopefully we'll be doing a little bit in person in the next few years. But until then, we'll just keep plugging along virtually.
Awesome. Melissa Darbandi from the Leukemia and Lymphoma Society is our guest today. Melissa, thank you so much for what you do, for what you support. I think it was great for our listeners to hear these stories and to hear what you do, and hopefully, we can get some of our listeners to get involved with you as well.
Well, thank you so much, Joe. It's been a pleasure.
Again, those websites that we were talking about today, lighttonight.org, you can read more about last night's event, and then lls.org, learn more about the Children's Initiative, resources that are available for families out there. That's it for this episode of the Saints and Alumni Show. Happy Friday. We're off to the weekend. I'm your host, Joe Formusa from the class of 2012. Stay tuned. WVCR will be right back.